Carlson, let's talk about a problem which many of us are having. We're wearing shoes, we're doing things on the feet, of course, and we get sweaty, stinky feet. And lots of things people try to do and whatever it is. What can be done? What are some of the things one should do? Can it be avoided, or is it just, if you have it, you have it. It's just gonna be there. Different type of socks we can wear, different materials, different shoes, other things we can do. Shed some light on it, please.
All right. Very interesting question. It is who the person is. It's their mechanical makeup. Most people that have very sweaty feet tend to have very, very sweaty palms, and it's just who they are. But there are some things that we can do. First of all, if the feet tend to perspire a lot, they are very wet, and that could lead to different kinds of diseases, meaning fungal infection, athlete's foot, fungal nails. So what we like to do is we always tell people if they have a chance and their feet and their socks get very wet, to change their socks during the day. Simple thing, wear a white cotton sock, change the sock at lunchtime, put it in a plastic bag in your bag, continue on. Another
Why
thing
white?
that we...
Why a white cotton sock? Why not black, blue, red, green?
Well, white is you always worry white is clean for infection. Black or blue, you worry about the dyes or any of the chemicals with that getting in. So.
I see. Okay.
The other thing that we could use is there's certain powders that are out now that actually help with the odor. Has a chemical in it called absence, and that actually really gets rid of the odor. So putting simple powder with this product in it, this chemical in it, helps get rid of the odor. The other
does it get rid of the odor, or does it get rid of the sweating in the first place?
Gets rid of the odor. A lot of people who have the very sweaty feet tend to have a lot of odor, and that odor definitely gets rid of that odor. Everybody knows somebody when they take their shoes off in the room, you're like, okay, we know the shoes are off. This actual chemical absence actually helps get rid of that odor. You put the powder in the shoe in the morning, you take your shoe off in the afternoon, and it really, it's one of the products that I found really works very, very well.
What product was that?
It's usually talcum powders that have absence in it. It's a chemical. It's called absence.
Where can you get it?
It's usually Podiatrist do sell. This is one from Gordon Laboratories. They have this product with this in it. They were the ones that discovered it. And it's usually a podiatry product, and podiatrists can either get it or carry it for you if you need it, order it.
Okay.
Other thing for wetness that they use, you could use antiperspirants for the foot. Some prescription products help with that and help keep the foot dry. And something that some podiatrists are doing is actually using Botox in the foot. They use it underneath the arm, but they can use it in the foot to inject. And what it does is it actually prevents the foot from sweating. And that's another treatment, but it's costly.
Botox in the foot, huh? And podiatrists are administering that, or do you need to go somewhere else for that?
Podiatrists can do it. Some of them do, or they could go someplace else and have it done by a dermatologist. It's the medical condition for sweaty feet is called hyperhidrosis, and people tend to get that under their armpits and sometimes on the feet. We wouldn't do it in the hands at all.
I see. All right. And when you have that, you don't feel like you're floating. You're like walking on like some blown up, cushion or so. No, you're still full function.
From what I understand, no. It goes in and it actually gets these sweat glands, and what it does is it actually freezes the sweat glands so they don't produce a lot of perspiration on the foot, and that's the mechanism that it works.
I see. All right. Now, so, okay, good. So, like, if a person sweats a lot, and so besides this thing, is there some other, because the shoe is in the black, so it's a good breathing ground for all kinds of, I guess, bacteria, funguses, because that's where they grow. I mean, as a kid, I noticed that, the best mushrooms were not growing in bright sun. So, what about that in connection with this whole thing?
Well, that's true. That is true. If the feet really perspire a lot and the shoes are wet, you are very prone to getting fungal infections. And a fungal infection of the skin is, a layman's term is called athlete's foot. And what also can happen is you could get a fungal infection of the nail, which is that thick yellow discolored nail, and that's called, the medical term is onychomycosis, and that is one of the things that is very difficult to treat. And the thing with fungus is, fungus actually is ubiquitous, meaning it's all over. And it forms little tiny spores that if it's not in a place where it likes to grow or an environment to grow, it makes these little spores and they lay dormant until it's in an environment to grow, meaning a warm, dark, moist environment. No better place than in a foot and on a shoe. So if somebody has chronic problems with athlete's foot or their nails, it's recommended that they, disinfect their shoes, spray their shoes, air them out in the daylight to dry. Don't throw them right in the closet. Let the shoe dry and then put it into the closet. So that's one of the ways that we help combat reinfection and fungus on feet and nails.
Okay. What about having as much as possible open shoes and, sandals and stuff like that? Does that help?
Oh, that's definitely a better option, but depending on where you live. Here in New York, we only have a couple months that we can do that. But even in the house, you should make sure you wear something that's open and let the air get to it, not a closed, dark, furry slipper. But some days like today, you kind of want that in New York because it's cold.
Well, all right. Good. Well, all right. Thanks a lot, Dr. Carlson.